Hello students. This lecture is called Antibiotics Used for Urinary Tract Infections in the Male Genital System. My name is Jeff. Let's get started. Overall, urinary tract infections are rare in adult males. Urinary tract infections are extremely rare in males younger than 50 years old. There's an increased incidence of urinary tract infections in males after age 50. That's because the male urinary tract has many natural defenses to infection. Experts consider UTIs in males by definition to be complicated. Common causes of older male urinary tract infections include prostatitis, epididymitis, orchitis, pyelonephritis, cystitis, urethritis, and urinary catheters. Let's talk about simple urinary tract infections in males. So by simple urinary tract infections, I mean not frequent UTIs. Antibiotics are the first-line treatment, and which specific antibiotics are prescribed and for how long depend on your patient's overall health condition and the type of bacteria found in urine. Drugs commonly recommended for simple UTIs are listed here. They include trimethoprim with a combination of sulfamethoxazole, also known as Bactrim, Septra, and they have other names for this as well. Phosphomycin, nitrofurantoin, cephalexin, ceftriaxone, ampicillin, amoxicillin. For severe urinary tract infections in males, your future patients may need treatments with IV antibiotics in a hospital. For simple UTIs, fluoroquinolones such as Cipro and levofloxacin are not commonly recommended. The risk of these medicines generally outweigh the benefits for treating uncomplicated urinary tract infections. However, in complicated UTI, or more importantly, in kidney infection, you could prescribe a fluoroquinolone such as Cipro or levofloxacin if there are no other treatment options available. By the way, symptoms often clear up within a few days of starting treatment, and your future patients will need to continue antibiotics for a week or more in severe UTI infections. Importantly, you need to counsel your future patients to take the entire course of antibiotics exactly as prescribed. This is to prevent bacterial resistance and is part and parcel with good stewardship of antibiotic use. Let's talk about Balanitis, otherwise known as inflammation of the glans penis. When the foreskin of the penis is also affected, the proper term balanopostitis. Balanitis on boys still in diapers has to be distinguished from redness caused by ammoniacal dermatitis due to a lack of frequent diaper changes. Balanitis is caused most commonly by Candida species, in particular Candida albicans, but occasionally Streptococcus or Staphylococcus anaerobes are involved. When Candida is involved, clotrimazole or miconazole, or when patients have a sensitivity to imidazole compounds, nystatin can be used. If Staphylococcus or Streptococcus anaerobes are involved, metronidazole can be used, or amoxicillin clavulanate, also known as Augmentin, can be used. Further, suspected staph or strep, mupirocin, also known as Bactroban, can be used. Bactroban is a topical antibiotic in the carboxylic acid class of medication. It works by blocking a bacteria's ability to make protein, which usually results in bacterial death. If it's a more severe case, cephalexin or clindamycin can be used. Student doctors, I'd like to now provide you with some clinical pearls. When indicated, you need to consider in your future patients infectious etiologies such as herpes simplex virus, HIV, trichomonas, syphilis, and you should likely screen for STD, STIs where appropriate. Additional non-infectious considerations could include chemical irritants, undiagnosed diabetes, an immunocompromised state, as well as reactive arthritis. Sitz baths, which is salt water with daily gentle retraction of the foreskin, might be considered. Balanitis that persists despite treatment mandates a urologic follow-up. Student doctors, thank you for listening to my lecture entitled Antibiotics Used for UTIs in the Male Genital System. There's a series of practice questions at the end of the PowerPoint or PDF for your perusal. Very, very scary fish. Walleye.